what is some advice or some tips, and also what to stay away from when it comes to a personal statement?
I
And
always
obviously,
tell
I know it's subjective, but
Yeah, I mean, it is totally subjective. So this is how to succeed if you're writing a personal statement for Dr. Leis to read.
welcome to the deep end. Today, we're joined by Dr. Amber Leis, Associate Professor of Plastic Surgery and the Program Director at Washington University in St. Louis. A dual board-certified plastic and hand surgeon, Dr. Leis has built her career around education, mentorship, and excellence in extremity reconstruction and brachial plexus surgery. In this episode, we'll talk about her career journey, her move from UC Irvine to WashU, and her insights on surgical education, mentorship, and shaping the next generation of plastic surgeons. Let's dive in.
So really, really, really fun night because I've been waiting to do this one for a while, and we're joined by Dr. Leis, and she's not busy enough. She just moved across the country. And so, but we've had many of our listeners request that we get her, and having known her for some time now and see her mentor others, interact at big national conferences, and offer her advice, I know exactly why people want her on, is because she's so incredibly special and she serves as such a great role model for so many people. And we're going to go into a bunch of things tonight, which I'm super excited about. Most importantly, it's application season, so that's going to be a big topic.
Mhm.
But more importantly than that, I think, Hank and I talk all the time about why we wanted to start this podcast. And it's been a lot of fun for us. And one of the reasons is because we're all separated by our individual conferences. Luckily, you and I get to interact a lot at national conferences, but we don't get to really hear from the aesthetic people or the hand people or the craniofacial people. So we wanted to reunite. I truly believe we have one of the best specialty, and we want to reunite all of the great minds onto one platform. But Hank,
Awesome.
anything you wanted to add before we get
No,
going?
definitely. I would just echo that. It's a great place to bring everyone together within our specialty. And then also to talk about things that you don't get asked about, even if you did go to those conferences, instead of the same lectures on like specific topics, some of the things behind the curtain to see what made people who they are. So,
That's awesome. Well,
yeah.
being invited here was kind of like this is one of those things where you're like, oh my gosh, I must have really made it. I got invited to be a guest on
Oh gosh.
the
Yeah.
podcast.
So one of the things, again, one of the things that Hank and I truly enjoy is hearing the things that people just don't get to talk about time and time again at these conferences. And I've kind of always been this way. I've always been curious about people's upbringings, like how they were as a kid. And so what did you like to do as a kid? Did you like grow up thinking, I'm going to do brachial plexus surgery? Tell me a little bit about your childhood.
I think I came from a very different childhood than a lot of people who are in plastic surgery. So it's actually something I really like to talk about because it's part of my mission and why in life is to make space for people who come from different pathways into our
Mhm.
specialty. But I grew up in a really rural part of Central Oregon with two hippie artist parents, and hippie to the point where they were totally forsook modern medicine. I was born at home with a midwife. I did not see a doctor
Mhm.
until I was 6 or 7
Wow.
years old. Birth certificate until I was 6 or 7 years old because my parents were hiding me
Wow.
from the government kind of thing. Like really,
Wow.
really special childhood. And I think there were a lot of great things that came out of that for me. I grew up with parents who were artists, and so they were potters, and I was in their art studio all the time as a child.
Oh,
And I
that's
think
so
that
cool.
it was a very liberating and wonderful space in which to just explore being a kid. And I think my parents were really supportive of whatever path I wanted to choose. And when they got tired of trying to wrangle me back into the house to try and complete my homeschooling lessons, they were like, all right, we're going to send this kid to public school. And it turns out I was good at math and science. And I think that was a little bit of an anomaly to them, but they were just, hippie artist parents. And they're like, that's cool. You do what you want to do. You're good
That's
at that.
awesome. What are some of the things that you've kept from that childhood of having hippie parents? Like do you like to, are you an artist, or is there anything from that you still like to do as a hobby?
Well, I preferred to do studio art classes when I was in college. I really enjoyed
Oh,
being
wow.
in all kind of artistic spaces, but I interestingly never became a potter because my father was so profoundly talented that I had it's just this level of imposter syndrome that is just crazy. I was like,
Yeah.
well, my gosh, I can't turn that thing out. And so I just was unwilling to put myself through the hours that it took for him to develop that skill. I was like, yeah, give it up. I'm never going to be that good. I'll do something else instead.
Yeah. Yes, and I think I saw a picture at one point on social media. Do you have a lot of siblings, or were you just surrounded by a bunch of friends?
No, I do have a lot of siblings. That's a great pickup. Part of having hippie artist parents is that they were not good at staying married. They were really good at having multiple relationships with lots of other people. I have 11 brothers and sisters, inclusive of
Wow.
all the step and half
That's
siblings.
so
And
cool.
Wow.
most of us were in the house together. Anyone that was in age
Yeah.
proximity that had to be in a parental home was in the home together. And so I never viewed them as not my brothers and sisters, regardless of whether or not they were full or half or step. But it was a pretty wild house. Holidays were crazy.
Yeah, did they, any of them pursue medicine or any of them influence kind of like, did you look up to or anything like that?
It's a great question. They're all incredibly different. None of them pursued medicine. All went in different routes. I have a brother who does drywall, a brother who does
I
teaches
could use
physics.
him.
Yes,
I
he's
really could.
really good at it, like really, really good at it. A brother who is a welder and teaches physics in high school, a brother who's a chemical engineer. My sister is a librarian, and it's like they just runs
Oh,
the whole
that's so
gamut of all
cool.
these different things. One of them is very into alternative medicine and does a lot of guided alternative therapies for patients in Oregon. So I think
Wow.
all of us have pursued excellence in different ways, but
Yeah.
very different ways.
So that kind of begs the question, what did draw you towards being a plastic surgeon, and especially not only not growing up with people who were plastic surgeons or doctors, but people who didn't even want you to have a birth certificate?
Yeah,
Yeah.
exactly. I think that in a way that actually really did push me towards medicine, because that point where I had to go into public school, it was like, this child is not vaccinated. This child has never seen a doctor. There were a
Yeah.
lot of things that had to happen. And so the only way that we got care from a doctor was from someone in our community who donated care to families who are incredibly low income. And I remember being very touched by that as a child. And I remember being touched by it because my parents were so appreciative of the free care that she gave us. My dad, in his many, many iterations of hippiness, also kind of had a little church, which was kind of borderline cult, maybe truly a
Mhm.
cult. But part of that was about practicing gratitude and having gratitude for things that were blessings in our life. And so they interacted with this physician in a way that really impacted me. And so I was like, all right, I want to do something important with my life. I want to be a doctor and take care of other people too. And they're like, that's great. You should totally do that.
Yeah. And then,
Yeah.
so then why plastic surgery?
That, I think, came out of all the artistic part of my upbringing. It definitely wasn't part of my immediate plan. When I was going into college, I thought I was going to be internal medicine. And then I really loved microbiology. And so I was like, okay, maybe I'll do vaccine development. I was like really, really into this different path. But as part of that exploration, ended up in Zimbabwe for 4 months as an undergrad,
Wow.
doing an internship in a hospital because I was doing malaria research, and got to observe surgery there. And it was, everyone has that aha moment. It was my aha moment. I was like, this is like sculpting in clay, but with bodies. And it was
Right.
just totally magical to me. And so when I entered medical school, I knew immediately that I was either doing plastic surgery or some other reconstructive surgery. Like that was the path I was on since day one of medical school.
Yeah. And one of the things that this is another thing about like kind of asking you about your upbringing. One of the other things that I'm always curious about is like in that setting of medical school, like while you're sitting amongst your peers and you're listening to a lecture, are you thinking in the back of your mind, you know what, one day I think I want to be program director? Like,
Oh, heck no.
no, so
I
it's
didn't even
not
know
one
what a
of those
program
things.
director was.
Yeah, exactly. So like,
Yeah.
so then how did you stumble across your first job? Tell me about that how that happened.
So coming out of residency, I went to a pretty small residency program. It was not super academic.
Mhm.
This was no Michigan or Stanford or Penn program. And so I didn't have a lot of role modeling as leaders in the academic space. And so the way that I perceived my future career was just someone taking care of patients. And so I finished my hand fellowship, was looking for a job where I got to take care of patients. And along the path of my training, I'd met my husband, who's a filmmaker. And so that had really tied us to
Wow.
Southern California. Like any job that lets me take care of patients in Southern
Yeah.
California, preferably doing something that involves hand surgery. And that job was not exactly a hand surgery job. It was just to be a plastic surgeon at UC Irvine. We needed someone to do that and take some hand call. And it was just one of those places where, in retrospect, I can look back on it. It was a blue ocean. It was an opportunity that was undeveloped. There
That's
was
so great.
no one there doing pediatric plexus. There was no one there
Mhm.
doing congenital hand. And those weren't things that I was like hard set on, like, I'm going to build this program coming out of my training. But it was like, these are the things that I love. No one's doing them. And between now and when I can make that program, I'm going to do a lot of breast cancer reconstruction. I'm going to take a lot of facial trauma call. I'm going to do whatever it is to make my practice
Yeah.
get to that point. But it was just kind of like an evolution of things that happened over time in the space where I was.
Yeah. So what happened during then that you became the program director?
That was the job that nobody wanted at the moment when I was there.
That sounds pretty familiar.
And I think I had really enjoyed an aspect of my residency training in that we were a very tight-knit group. There was
Yeah.
a lot of senior residents taking care of junior residents. There was a lot of inter-resident teaching, and I felt very bonded to my resident family. And so I think that had kind of set me up to be in this position where I felt like I was like, oh, I like mentoring. I like taking care of these people. I like teaching them what I've learned and helping them
Mhm.
avoid the mistakes that the things I learned the hard way. And I felt like on the outset that being program director was that job. I was like, oh, this is great. And what I learned on the other side being program director is it is that. And it is also the, like, you have to
Yes.
write all the policies. And when people misbehave, you have to discipline them. Like, it did very much change the dynamic of the way I got to mentor my own trainees because it put me in a different role. And that definitely took some time to develop and grow into.
Yeah, and we're going to talk about the sort of program director insights at some point. But one of the things that Hank and I were also curious about is you built, as you said, you called it kind of like a land of opportunities when you went there, and were able to build this practice, which is pretty incredible. I mean, you've also showcased a lot of it on social media and have done it so well, particularly because I feel like in our specialty, there's such a strong presence on the aesthetic side on social media, but you are the role model when it comes to academic and how to use it to educate not only patients, educate residents, and your outreach is just incredible. So what do you think social media, where do you think it plays a role in terms of surgical education today? And what advice do you have to give to trainees? Because it is kind of a fine balance where you have to use it well and not kind of have it overcome your life in a way.
Yeah. Well, first of all, thank you for the compliment.
Mhm.
It's been a very, it has also gone through an evolution, but it's also been a very intentional practice. When I started in the role of just an academic, physician, teaching residents, I was not on social media. I'm right in that little threshold generation where
Mhm.
sometimes I'm a millennial and sometimes I'm Gen X, and it depends on how you're cutting everything. Um, but it wasn't like a native thing for me. Like I wasn't running out to join Instagram, but I was in the operating room, and I will never forget this moment. One of my senior residents was like, "Oh my gosh, I have to show you this thing on Instagram." And it's like, "What? Show me." And she shows me this post from a private practice aesthetic surgeon. And it was just so egregiously repulsive on multiple levels
Yeah.
that I was like, I am going to get on that platform tomorrow because I can't have every young medical student in the world looking at this and thinking that's what plastic surgeons do.
That's
And
true.
I
Yeah.
certainly can't have the public thinking that that's what we do because, my gosh, like there's no greater discredit to us as specialists
Mhm.
or experts in any way if that's what's getting perpetuated.
Mhm.
And so it was like one of those things I always tell the residents, it's like it's your boards, you get your casebook, you have to like define the problem and define the solution. I was like, this is a problem and I'm going to define the solution. This is an educational platform. And I think I tried to be very conscientious of what my patients and my patients' parents, what their reading level is, what their comprehension level is.
Yes,
I try not to be
absolutely.
too over wordy because I want them to understand what we're doing.
Mhm.
But I do think it's a really nice way to showcase some of the awesome things that we do. It's, just a slice of my life in practice. There are people doing other incredible stuff, but
Mhm.
I really appreciate that it has landed in a way that has been meaningful for people.
Yeah, I think one of the things I add to what you said, plastic surgery, again, behind the podcast, it's so much more than just aesthetic surgery. It's so much more than craniofacial surgery. And it's nice to also from like from an inspirational standpoint to inspire the next generation of plastic surgeons to show them that we have all these wonderful subdisciplines within the realm of plastic surgery, including all the extremity reconstruction cases that you do. And I've read some of your captions and they're so incredibly detailed, but so easy to understand. And it's really nice how you kind of tailor that to an audience and allow for the education perspective because that's such a powerful side of social media. So I think it's important for our audience because some of them had questions on how you use it. Also, do you get consent for your patients for showcasing cases, et cetera?
Yes, absolutely. I was like, we can talk a long time on nitty gritty and nuts and bolts, but I absolutely get consent. And what has happened over time is that there were, particularly because I take care of a lot of pediatric patients, I will have parents come to me and say, "Hey, I saw your, politicization on Instagram, and that's why we chose you as our surgeon." And so when it comes time to, finish their child's care, I'll say, "Is it okay with you if I also share your child's pictures so that other families can be educated?" And I find that Parents, especially who have found me that way, are really, really excited to be able to share their children's experience and stories. It helps, I think, that do hand surgery, so it's much less identifiable. It's not kids' faces, but it is usually a question that I ask at the end of the postoperative care. Unless sometimes you get these teenage kids that are
Yeah.
like, "Are you going to put my story up on Instagram? I want to show and tell my
Yeah.
friends." And I'm like, "Okay, fine, we can do that."
Yeah. So one of the things that I find so interesting is people who develop a career, they make a name for themselves, and then they're like, what's the next biggest leap of faith or something that's so courageous as to leave that behind and move across the country to take on the next big challenge? Because a lot of people would play it safe or not even play it safe, but they already have something good going there. You said your husband's a filmmaker, he's gravitating towards the West Coast. So what was the impetus to, leave that behind and take on this next big chapter of your life at WashU?
It has been such a profound change for me over the past couple months to be in this new role. And there are moments I tell people it's like having this cyclic anxiety where I'm like, oh my God, what did I just do? Why did I just give up all my practice? Then I just like give myself this little pet,
I
like it's
know.
going to be okay. Everything's going to be okay. It's going to be amazing. But
And it
it
was.
really, it's like it was and it will be and it will continue to be and it will be its next iteration. And I think that as someone who has always lived their life in a way where I've just kind of been like, okay, here I am and what are the opportunities and what can I do with them? Making a big transition like this feels like a good thing to do because I'm not the kind of person that's like, in 5.5 years, I will be the president of this society and I will have accomplished these things. Like I
Yeah.
don't have those kind of goals for myself, but I really feel led by what feels like, emotional resonance and opportunities and things that feel like the next best place for growth. And I really got recruited by the team at WashU to take education to another level in plastic surgery. And it felt like a really awesome opportunity to have people who were so invested in making education and surgical education better want me to come into that space and bring whatever skill set I had to share with them and do what we could with that. So it has been a really awesome decision. And I tell people every day it was the second best choice I ever made after marrying my husband, but it is not without some like periodic cyclic anxiety.
Yeah. We'll make sure he listens to the podcast.
Yeah.
But it's funny because like I have like I'm in general pretty emotional, and I think like whenever I leave something behind, it like saddens me a little bit. I miss the people, I miss the places. I think about like the ice cream store I always used to go to, and when I was seeing your goodbye posts when you were leaving California, it was like I felt like I was leaving. It was like
Oh,
deeply saddening, uh, and I agree with you, Hank. I mean, to have something where you like you're set up, things are going smoothly. It is almost like a risk, and this is something that comes time and time again in these podcasts where people move on to the next thing, and they're just like, "Well, we'll see how it goes." And hope for the best. But you followed such a amazing legacy in plastic surgery at WashU. Susan McKinnon, and we did a podcast with Allison and Amy Moore as well, and they talked about her influence. Talk a little bit about how she perhaps what role she may or may not play in your decision to pursue education, take education to the next level at that institution that comes with such a tremendous legacy.
I mean, no lie, she was a huge draw for me to come here. I tell medical students today, who were just as clueless as I was when I was in their shoes, when I didn't even know what a program director was. But I tell them, I was like, she's arguably the most famous surgeon in the world, period, regardless of specialty.
Mhm.
Like, she has really changed the
Yeah.
landscape of how we think about repair for nerve injuries and how we think about so many problems when we think about peripheral nerve. But what I have seen over the years interacting with the people who have trained with her is that she has also profoundly impacted them from the way they think about themselves, the way they think about their communities, and the way they think about their patients and their trainees. And I really, really wanted to be in a space where I could learn from that in a more dedicated way. I have been so grateful to even have any time with her at all. And it was a big part of the draw to be here. Because again, I came from a very small non-academic residency program. The opportunity to kind of have the mini fellowship that I never had is really special.
Yeah. And so what are kind of the things that, and I'm curious about this as well, just for myself, like what are the kind of the things that you thought may have been were a little bit more challenging than you expected with regards to the move across the country? Like, do you
I
think
mean,
like meeting, like leaving your friends behind, or like finding your new favorite stores, or what do you think were the more challenging than you expected?
I think just the move itself is physically very hard. You
Yeah.
Oh
have
my gosh, I don't ever want to move again.
I know. It's like, how did I accumulate so much stuff and how have I managed to lose it so quickly? And we're still in transition. We're in an apartment, so like 90% of our stuff is in storage. And every other day, I'm like, did we not put the pot mitts in the box for the apartment? No? Okay, time for Target.
Yeah.
Yeah, exactly.
So, I mean, honestly, I think that's been one of the hardest things. Like, it was brutally sad. I was so excited to take the job. I was so thrilled to tell everybody. And the moment I started disclosing that, I just started sobbing, and I feel like I cried
I
for
know.
4 months straight.
Yeah.
It was such a heartbreak. That was really hard, but the world is very small. We're bound by so many technological advances. I don't feel like I'm gone from these people. I still have
Yeah.
mentoring sessions with my residents. I'm still like in contact with them. I'm still setting up. One of them's coming to the pen flap course with me. I'm going to take her out to dinner.
That's so
It's
great.
the network is still there. And so I don't feel the loss of that as acutely as I was afraid of it. I think the technical aspect of moving was just miserable, and that's probably the hardest part.
Oh
Yeah.
my gosh.
And then the just anxieties of being like, oh my gosh, my clinic isn't full of like pediatric plexus every day. I have some kids with finger warts and like other stuff. There's that little part of like starting over where like, why did I do that to myself? I did it because, I trust myself. I built that once before, and I know I can do it again.
And you're starting to.
Yeah.
I've been following along. I've seen some of the cases. They look great.
Yeah, it's awesome.
What do you think excites you most? You talked about the educational aspect. Do you think that that's what excites you most about this new role?
It really was, I think, the single biggest draw. And one of the advantages I had in my medical school training is that I was at Hopkins, which is just this incredible institution. I think of it as it is almost like a spiritual experience. It's a cathedral of education, and people there so value
Totally
what it
agree.
means to be an educator. They so value what it means to do good research. They so value excellence in clinical care. And I missed being in an environment where that was so prioritized and prized. And obviously, it's a privilege of being at a place with an incredible endowment and all the resources to do that. But WashU definitely had that same feeling for me. And when I came out and I met with the deans of the medical school and all the people in leadership, there was just so much enthusiasm and excitement around me for being excellent at education and thinking about how to innovate in education. It was just like this, like I came home from the interview and I was like, this is so incredible. I'm so excited. And 90% of the days I come home from work, I'm like, I am so excited for what happened today.
Oh my gosh, that is
That's
so
awesome.
cool. That is so cool. And it seems like UC Irvine was probably the best first step for that because it sets the foundation for like a bigger institution in general and managing
Yes.
more residents probably.
Yeah, I think it was, I have nothing but gratitude for my first job. I mean, it gave me an incredible opportunity. It gave me an incredible experience. It allowed me to develop leadership. It allowed me to develop a clinical practice and some expertise that, I wouldn't have this position without having had that as a start.
So your husband's no longer filmmaking?
Oh, he's filmmaking. He figured out post-COVID that he didn't actually have to drive to LA every day. He was like, everybody does this on Zoom. Why am I driving into LA? And that really started to liberate us.
Nice.
Well, that's cool. So one of the things that we've had a lot of questions about is stuff pertaining to kind of the application and in general the match. A lot of the people who listen sometimes are applicants and even trainees. What do you think makes somebody stand out as an applicant when it comes to plastic surgery? Everyone talks about nowadays, USMLE step 1 is pass fail. Everyone's starting to do research. What are some qualities that you think make particular applicants really stars when you're looking at their applications?
I think I will always have a little bit of a bias to look for the applicants who are like the hidden gems also. And so what I'm really looking for when I look at applications is I look at people who have grit. I look at people who have achieved, it's the distance traveled kind of concept where maybe they came from hippie artist parents who hid them from the government for 7 years, but they figured out how to do well in school. It doesn't mean that they went to like a top tier undergrad program, but they did a good job where they were. And so I really like hearing people's stories. I know there are a lot of people that find the personal statement aspect of the application something that is kind of throwaway, but it is one of my favorite parts of the application because it's a place where I actually get to see who people are. And the people that reveal that to me, I'm always curious, to hear more about them, to find out how they ended up in the place where they are and what they did with what they had.
Yeah.
And just like a practical tip in terms of like personal statements, what are some things what is some advice or some tips and also what to stay away from when it comes to a personal statement?
I
And
always
obviously
tell
I know it's subjective, but
Yeah, I mean, it is totally subjective. So this is how to succeed if you're writing a personal statement for Dr. Leis to read. Other than that, for like who knows what else. But my biggest pet peeve, and I will tell you, I'm guilty of this pet peeve because I look at my personal statement and was like, God, I made all the mistakes.
Yes, me too. I can't even read mine, honestly.
It's like mortifying. But I tell them that it's not a creative writing exercise, it's a persuasive argument. So you're making a persuasive argument to me about who you are and why you should be a plastic surgeon or why you should be a plastic surgery resident in my program. But I feel like so many students feel compelled to write us a creative writing exercise about why plastic surgery is great or what was beautiful about the operating room. And I'm like, we all know that already. That's not a secret to us. We chose this career. So tell me something I don't know, which is
Yeah.
about yourself. Tell me who you are.
Yeah.
The tip that I offer over and over, and I will beat that drum until the day I die.
Yeah.
Hank, I need to reread your personal statement.
Oh no, please don't. We should do
It's
like,
definitely basketball.
We should read it live on the podcast.
Oh, we're
Oh my
going to. I'm
gosh.
just kidding.
I was
No,
like, I'll
please do
totally,
not
I was
do
like,
that.
mine is so bad.
No, you're so right about the creative writing exercise. I love picking up little tidbits, like little unique tidbits about applicants. I think that's one of my favorite thing to do in a personal statement. I always find like even when I listen to somebody talk, like even at a conference, like when everything's so scripted or rehearsed, I kind of lose attention and focus. But then when something gets like unique, it gains my focus, and I love that. And I think I agree. I think it's such a powerful part of it can be such a powerful part of a strong application. You obviously want to watch out for any red flags.
Yes. Yeah.
Uh,
Totally true.
For one of I guess not necessarily a pet peeve of mine, but something that I struggle with is, and it's, I guess in part, again, I have a big heart and I do feel bad for this, like a stigma behind people who don't match, because I have a few mentees currently who didn't match the first time around. And the way that I talk to them is I say, when you try for the plastic surgery is the most competitive specialty, if not like it's definitely one of the most competitive specialties. And it's like if you try out for the Olympics and you don't make it into the Olympics, it's not like you just like quit for the rest of your life. You try again. And so like that's how I try to phrase it to them, because I'm saddened by how like automatically you don't match and then there's a bad stigma attached to that the second time around. What advice do you have on people? Kind of a two-folded question. Anybody who does not match, what advice do you give them? Like almost like you open your letter, you don't match. What's the next step? That's number one. And then number two, if you didn't match and then you're starting to go on your interviews the second time around, I kind of tell people that you have to be prepared to at least talk about it, talk about what you've done differently and things like that. What advice do you have there as well?
I mean, I think I'm totally in agreement with you. And I think that there is a concern that people have because they're always like, well, was there some red flag that I missed? And that's why this person didn't match. So I think there is a little bit of stigma because people are anxious. Like, was there something I need to be aware of? But because we have such a competitive specialty with so many people applying at so many more than we have spots, it's going to be a natural thing that happens every year that good people go unmatched. And so at UCI, we had several residents who were unmatched the first time, who were spectacular residents. And I actually really loved having them in the program because they had done something with that in-between year, prelim year or research or something that made themselves a better applicant, got a little more maturity.
Yes.
And so I agree that they need to be able to talk about what they did. I think that the really good personal quality to develop that will, create success in your life for the rest of your life is to be someone that can take a setback, take a look at things, not lose your mind and say, okay, here's the situation. I can figure out what went wrong and here are the things that I have the ability to fix and here are the things that I don't, and I'm not going to worry about that and I'm going to focus on what I can make better. And I think the applicants that do well are the ones that are like, okay, this part's out of my control. This part I didn't do well on this. This is how I'm going to do better the next time. This is how I'm going to solve that problem. And I think when I see that quality come through in an applicant, I'm like, this is a person that's going to do something wrong in the OR. And I'm going to tell them, hey, that's not the way we do it. This is the way you need to do it next time. And they're not going to come unglued over that. They're going to be able to pick themselves up, take the feedback and move on and do something constructive with it. And so I personally actually love to see the repeat applicant who has done something really productive with the feedback that they got. And that is incumbent upon them having a mentor who's willing to give them that feedback. And I think that's a job that all of us in academic plastic surgery have, is to not sugarcoat things for applicants who've gone that, unmatched cycle, but to sit down like this is what you need to do better. And I have gotten better at giving hard feedback specifically because of that setting, because of so many unmatched mentees where I'm like, okay, I'm going to have to tell you the thing that's the truth, even though it's not a pleasant thing to talk about.
Yeah, no,
Yeah.
you're so right.
Yeah, you definitely need to be coachable and have like a self-awareness there. What's your opinion on, dual applying like general surgery
Mhm.
or just especially with the landscape of independent programs, decreasing?
Yeah.
That's another difficult topic.
It is a super complicated topic, and I think that the data about how the independent trainees stack up against the integrated trainees is something that still people are trying to parse and figure out, is one actually
Mhm.
superior? Do we really need to be moving all to integrated? Is
Mhm.
there a reason to make a decision one over the other? I think there are enough people in academic plastic surgery right now that trained on the independent pathway that I think it would be a long time before that pathway would fully disappear. And I
Yeah.
know that there are certainly programs that are actually starting independent programs. And so I think at least for a certain stretch of the foreseeable future, it's going to be around. And so for that reason, I usually counsel applicants that, plastic surgeons go into the OR with plan A, B, and C. You need to go into the match with plan A, B,
Yeah.
and C. And plan B doesn't need to be applying in general surgery if that's not authentic to you, but plan B needs to be something.
Yeah.
You got to figure out
Yeah.
what plan B is. And so for some of them, that's dual applying in something like psychiatry. Who knows? It's like whatever their other passion is. Some of them it's doing a
Yeah.
research year, some of it's doing a prelim year, but you got to have a plan B and C. And I think that's just realistic. It needs to be tailored to who you are and what your strengths are and what your application looks like. And there may come a point where a cat jumps up here or starts yelling at us.
But
Yeah, I was
we
gonna say,
welcome
I
that.
just
We love
yeah,
that.
yeah. We've had that happen before.
Yeah, we've
Yeah,
had guests bring their babies on as well.
Okay, great.
you
I
know,
was like, I hear her back there.
I
was like,
heard
"Uh-oh."
it too, and I thought it was one of my kids. I was like, Shh, Georgie, don't make noise.
I'm like, no, shh.
But what at a conference, I think this was at the winter retreat, where I stood up and I said, I'm kind of disappointed with the stigma for the unmatched applicant. And I don't know how we can ever control that. But somebody immediately after I said that said, raise your hand in the audience if you didn't match the first time around. And I looked around and I was impressed by not only the hands that were raised, but the hands that were raised by people who are now in leadership roles in the society.
Right.
So, and we did a podcast, Hank and I, with Rodriguez from NYU, who talked about not getting into medical school, with Scott Levin, who had to go to medical school in the Caribbean, or not the Caribbean, rather, just outside of the US, and then transitioned to the US for medical school. So there are all these examples. And I just want to encourage everyone that's listening, that it's a tough specialty, but if you want plastic surgery, you're going to find a way to get it.
Yeah.
So another important topic is research time. And I think that if you looked at, this would actually be an interesting study. If you looked at USMLE going pass fail, I have no doubt that probably the number of publications per applicant is probably going up. And how do you counsel applicants on whether or not they should take a research year out? I guess we'll start with that. What's kind of your advice?
I had a lot of feelings about this one, so it's going to be a hard answer. I get really actually a little bit riled up about the amount of time that we are recommending for students to take research years.
Yeah.
And I think that there's a very specific subset of student that benefits from a research year, and that student is a student who has no home program or has limited mentorship in the program that they're in. That's a student that needs someone to mentor them, to spend time with them, to write their letters of recommendation, to go out on the interview trail and be like, hey, you need to interview this person. They're incredible. But we have all these kids at top tier programs around the country who are getting exposure to research and getting exposure to what it means to write papers and critically think about the literature. And they don't need to be taking a year out of their life to do research just to match into plastic surgery.
Yeah.
If they think they're going to be the next, triple threat, great, start that process early. I'm happy to support that. But we've just seen this ridiculous escalation in the number of publications coming out for medical students. And then you look at the quality of the literature that's being produced.
Yes.
And it's not like it's really contributing something meaningful to our specialty. And I think that drives all kinds of other interesting little industries, which are probably beyond the scope of what we need to get into right now. But I don't think it's healthy, and I don't think it's beneficial for us. And it feels exploitive. And I really have encouraged most students that I sit with to think really critically about what their motivations would be. And if they're at a program where they have a home residency program and they are not passionate about research, I really strongly encourage them not to take a research year. But those kids at no home program schools, I'm like, you should absolutely do that, because this is how you land yourself a good mentor in the academic community who's going to help you get past this hurdle of not having sponsorship otherwise.
Yeah.
That's such an important point, especially about the seeking mentorship for people who don't have a home program. And I actually think, our efforts are in a way can work against us. Like, I treat it almost like my kids. Like if I force my kids to do, like if I force my eldest daughter to just read, she for whatever reason just doesn't like to read, and it's because a lot of times I'm forcing her to read, whereas the other one is fine. But I feel like if we force people to do research, then we will almost like lose the passion for research. Like the person who just wants to do one publication and enjoy that one publication over a year, rather than put out 20 publications just to match into plastic surgery. So I
Yeah.
couldn't agree with you more. I love the fact that you actually talk to them and have them think critically about it.
Yeah, because it's almost become almost like an arms race. How many publications you can get
Yeah.
versus your genuine interest and learning something and actually furthering, our specialty.
Yeah.
Yeah. And of course, it's like we have all this data that's like, oh, look, students that have more publications match. So then the students are like, my gosh, yes, I
Yes.
have to have more
So they
publications. I'm
feel
like,
like
just
they have
stop,
to take a
just stop.
research year. Yeah.
Yeah.
It's crazy pants.
Yeah, I'm thankful in a way that, and I do feel bad. I feel like it adds so much stress. Not like there's not enough stress. And I'm just so thankful to be a part of this specialty, because when I come across some of these applications, I'm like, there's no way I could do this, even if like there's absolutely no. So what advice, being that we're probably close to when applications are going to be sent in,
Yeah.
you submit your application and then there's a wait period. So what do you think like applicants should do? These are the other questions that I get too, is like,
Yeah.
should you then approach programs prior to getting interviews to express interest, possibly? How do you prepare for an interview? How do you approach that?
I think the landscape is always changing a little bit as we increase the number of signals and kind of tweak the metrics
Yes.
of how the application is going to work. And so I
Yeah.
think in the setting of 20 signals this year, what I've been telling students is that if you haven't signaled a program, it doesn't matter if you email them. It doesn't matter if you have your mentor
Right.
call them. They're going to look at it and be like, you didn't signal my program. I'm not,
Correct.
in the top quarter of programs for you.
Yeah.
So that's not going to land. But if among the 20 programs that a student signaled, there are a couple that are really, truly their heart's desire, then I think it is really good to have your mentor reach out, the student's mentor reach out to people at that program and be like, look, this is my student. They signaled your program. They really, really are interested in coming here. And this is why I think they would be a great fit for you. That's just going to help put that application up a little bit higher in the review cycle for someone to be like, okay, I'm going to spend some special time on this and make sure that I'm not missing something.
Yeah.
Yeah, that's great advice. Because you're right. I think by increasing the number of signals, people are going to be thinking, the programs that don't get signaled are definitely going to be saying, well, there are 20 signals. Why didn't we get signaled?
Yeah.
Yeah. And that also brings up something that I wanted to bring up earlier is we were saying how there's a lot of pass fail, with testing. There's not a lot of objective measures. So one of them is like doing a sub-I and being able to be seen, on the playing field. And I was wondering, just for sub-Is who are listening, what are some things they can do to stand out, just to, impress
Or not
people in the
stand
audience
out
or not stand out. Yeah.
in
Yeah,
a
there's
good
like stand
way.
out in a good way. I mean, I think it's a really important question, Hank. And I think just,
Yeah.
even to circle back to what you said earlier, Syed, about this being like trying out for the Olympics, it's
Yeah.
like, this is like they're trying out for the Olympics, but they've never been timed in any race they've ever run in their
Yeah.
entire life. And they're like, as it turns out, you run, like slower than a snail. Maybe this is
Yeah.
not the right specialty for you. So it's like, it is really hard that they sometimes don't get that objective critical feedback until they are, knee deep in the application process. And it's really hard to change lanes. But I think that for any student who is going on to sub internships, being as prepared as possible for that location, being as prepared as possible to engage with the team, it's like that's getting involved, being helpful, being not too helpful. It's like there's so much about this that's about emotional intelligence.
It's
Yeah.
And so
so
the
true. It's like
more you can
innate
cultivate
emotional
that.
intelligence. Yeah.
Yes, it's like
Yeah.
just cultivate it, get that feedback as much and as early as you can on whatever rotations you're on. It's like OB-GYN, psychiatry, surgery, whatever you've done, try and figure out how to be excellent on all those rotations and get a lot of good feedback so that when you go out on your sub-Is, you can
Yeah.
adapt to the environment, figure out who the players are, figure out how to engage with them in the way that's best for that space.
Yeah.
It also brings up a point, when we talk about this, and Hank, you're closest to this than anybody, but I feel like maybe we should get to the point where we teach emotional intelligence. We teach so many other things because you're right. It's so important. We all have those medical students that just have this innate, like even technical ability. Like sometimes I'm like, oh my gosh, they're suturing backwards better than like a resident,
Yeah.
It's amazing.
Yeah. And I think a lot of it also I have a sports background, so playing basketball or tennis, a lot of it just comes with being as much in the OR as you can or being on the field as much as you can. You'll pick up on the nuance. If you're just
Definitely.
in there, if you're scared to get in there or you're not in the OR every chance you get, it's hard to know like the cultural nuances of being there and what your
Yeah.
role is.
Yeah.
Yeah, I don't know how to teach emotional intelligence, but I think when we figure out how to do that, that's going to be a critical step.
I
Yeah.
forget which nerve that is that you have to
Exactly.
know.
It's like you just
Yeah.
supercharge it. There was this incredible speaker that came to the women plastic surgery event this last year, and she's the author of a book, I think it was called The Unexpected Spy, and I'm totally blanking on her name right now. But she taught people how to become spies. That's like what she did. She worked for both the
Oh,
CIA
wow.
and the FBI. She had this incredible career, part of the team that brought down Al Qaeda. And she was like, she could tell on day one when these people would come in, she was like, if they had emotional intelligence, they were going to be excellent spies. And if they did
Yeah.
not, they were going to be terrible because that's all it took. She was like, if you have that skill set, you will figure everything else out.
Yeah.
That's pretty cool.
That is pretty cool. And I know like some programs do, I know for fellowship at MSK, they send out kind of like a pre-interview questionnaire
Really?
that kind of tested some of this stuff, which was sort of interesting.
I'll check that
Now,
out.
shifting focus a little bit from talking about applications, what do you think is like the number one thing as the program director? Like, what's the top of your priority?
My gosh, I was like, top of priority is just like staying on top of the to-do list. But
Yeah.
I think truly in the bigger picture, the next big thing in plastic surgery education is this move towards competency-based
Yes.
education. And people get very excited about this because it's different than time variable education. There are two different terms that often
Yeah.
get kind of paired together, but they're not the same thing. So time variable says you can finish residency at any point when you achieve competency. And competency-based education says here are some objective ways that we're going to assess competency. And those two things can be used
Right.
together, but they are also separate. And general surgery has rolled out these entrustable professional activities and using Firefly as part of their actual structured evaluation for all residency programs. I'm very curious to see how that works for them. The plastic surgery community is working to try and develop our own set of EPAs. The Canadian system has been on EPAs for a while. I think that's where we're moving towards. But I think we have a lot of room and space right now to shape what that actually looks like. And I think that's what's exciting right now.
Do you think there's room for if you know early on you want to go into hand or if you want to go into craniofacial, would there be a way to like mold your 6 years into being more heavier in one of those aspects, maybe too?
Or pre-specialize or do these like
Yeah.
embedded
Yeah.
fellowships. I know there's a lot of talk about this, and I think as someone that trained in a little bit of an older school model, it's really hard for me to recommend that to people because I
Yeah.
gained so much from all
Hmm.
of the other aspects of training that I went through. I mean, there are things that I do in hand surgery that I do because this incredibly talented craniofacial surgeon taught me how to manage the facial skeleton that way. And I'm like, I do that because he taught me
Yeah.
that.
Yeah.
Yeah.
It's not something I learned from my hand surgeons. And
Yeah.
I think that there is a great deal of strength in what we do as specialists when we have had such a broad specialty education. And when I talk to my trainees that are interested in, hand surgery and like, should they do this embedded hand fellowship? I'm like, you should only do that if you promise me that you're going to do another fellowship afterwards in a different specialty, because I feel like you miss some parts of your
Yeah.
development. And I know that's very like old school sounding, but that's just where I feel all of things.
No,
Yeah. That
it's
makes
true.
sense.
Yeah, I trained at Hopkins for general surgery and with Pam Lipsett, who we've
Oh,
talked
I love
about
her.
before. I know. And so during our training, like halfway through, Hank, to your point, they started this thing where you could early specialize in the middle of your residency. So like somebody just during their residency did a transplant fellowship. You had to
Oh,
do it
wow.
at Hopkins or did vascular surgery fellowship or whatever. And we all thought it was going to take off and that was going to be like the next best thing. And then slowly we transitioned back away from that for reasons that you mentioned. So
Yeah.
it's sort of interesting, but talk about the competency thing. So talk about like the thankless job of the program director. That's another thing that is a huge headache. Because then what do you
Yeah.
do for the person that ends up graduating early?
Yeah. Oh man, I don't even know. I was like, I think the only program that is
Careful what you wish for.
yeah, exactly. I think Pittsburgh and Hopkins are two that are
Yeah.
actually employing competency-based and time variable education. And I think Hopkins has their two earliest graduates coming out this year, and they're basically putting them into junior attending positions for a year,
Yes.
which I think is probably the way that people would start bridging that, because it's just something that's so new. I don't know that people know how to manage it and how to deal with
Yeah.
it.
I'm thinking as a second year, I'm just thinking about that call pool is what I'm thinking of, how that gets messed up.
exactly.
Yeah,
I would
I'm
just
sure there's
graduate
like
early just for that.
so many headaches. And I'm sure it's all solvable, but it's just it's going to take me a while to feel like we really could have a good metric and a good way of saying, okay, this person is ready to go early. You know, they've learned
Yeah.
everything that they can. They've been so excellent that they won't benefit from having some more time.
Mhm.
Yeah.
That makes sense. So in this whole journey across the country and having some time, maybe less time than you'd like to reflect on yourself and your own strengths and weaknesses, what do you think surprised yourself the most about yourself during this whole career transition?
I think you have touched on a topic that's been really meaningful to me, especially over this last couple months, which is that the chance to have a new job is a chance to reinvent yourself. It's a chance to
Mm.
say, like, here, and I have been so grateful for the time to reflect what I have been given. And you're right, probably could stand to have some more, but here we are. Um, it is a little bit of a pause and a break where you're like, okay, like what happened over the last 10 years? Who was I when I started, and where did I end up at the conclusion of my time there? How did I grow and change? What would I like to be for the next iteration of myself? What do I want to keep? What would I like to get better at? And I think the things that have surprised me have been how easily I was able to reconnect to some of the deeper joys and deeper passions in medicine, things that had felt like they'd gotten a little bit buried and a little bit calloused, and just open those back up and make more space for them in my life. And it's been a really big part of my joy in this job transition, is having space and recognition and appreciation for what I bring in that aspect of education. I was like, probably my husband.
Yeah, I thought you were going to say
I
that.
was like, I think that's probably
Yeah,
it.
show us your cat. Where's your
I was
cat?
like, she is, she just strolled out of the room. She comes
Okay.
in, like
Okay.
eats a little cat food behind me, yelps, and then walks out. She's like, I'm still here. When she comes back next time, put
Okay.
her food dishes right over there. So she'll be back again.
So
Um,
what do you do outside of work? Or do you have time even outside of work?
Outside of work, normally, when I have a house and I have a space to do it,
Yeah,
things
when are
that I
you
really,
buying? Are you looking for a house?
my God, Tony, it's like such a sore subject right now. We've like been outbid on 4 homes already. I'm like,
Yeah.
it's like, it's so
Yeah.
crazy. Everyone told me it was like lower cost of living, cheaper than California. It's a lie. The home
Yeah,
prices here are the same
it's
as
crazy.
California.
Where are people coming up with this money from?
Yeah.
No.
They are not academic plastic surgeons. I can tell you
No,
that.
that is 100% the truth. I'm like, what are you talking about? All cash out for bananas.
Yes.
But outside of work, when I had home and space to do things, I really like furniture refinishing, and I really like
Oh, that's
I
cool.
like
Yeah.
upcycling is kind of what I call it, but it's like getting vintage clothing and vintage items or thrifted items and salvaging them. And I have found some incredible things. I had like these gorgeous 18th century gilded plaster frames that I got for
Wow.
$11 at
Wow.
a thrift store.
Wow.
And no lie, I used what I learned from our craniofacial surgeons and did dental molding, like took casts of the parts that were not broken and repaired the plaster and re-gilded them. It's like I like doing
That's
these little
awesome.
What would you
crafty
have done
things.
if you didn't have that aspect of your training? What
Yeah,
would
I
you
was
Exactly.
have
gonna
This is
done?
why
say
you
that's
have to
why.
have craniofacial training. I had a dental impression. I had to do that. But I really like doing those kind of things. And I like doing them. I think you're right. They keep me grounded. They remind me to have gratitude. They remind me to take care of the things in my life. They remind me that there's a history to the world around us, and we are here for a small time.
Yeah. You're so right. And so talk about small time. Sometimes I hate talking about regrets, but I think back on my own self and my time and think about if there's any regrets, and I definitely come up with a few. And is there any advice you'd give your younger self?
Yeah, I mean, I have so many regrets. What I am learning to do for myself in this process is to see them less with shame and more with like, that was just part of my journey, and
Yeah.
trying to have a little more compassion for
Yeah.
myself in those stages of my early life. I think the advices that I would give myself would be to be more aware of the network and community. I think just in part because of the way that I grew up and the way that my education took place, I didn't really see the broader academic community of plastic surgery until I was already several years out into practice.
Yeah.
And so I had failed to build friendships at different points in my life that I wish I had taken more time to develop, and I'd failed to appreciate how much that network could have supported me through different times in my life. I have that network now. I'm like, man, I wish I would have had it younger, and I wish I would have appreciated that it was always there for me. And I probably would have been less hard on myself for some things that happened, and more willing to just be like, it's all going to work out okay. Just like keep going, keep doing your best.
Yeah. Hank, what regrets do you have? Do you have any regrets yet?
I have a lot in my short time. I actually just turned 30 this past weekend.
Such a
I was going to
baby.
say you look older.
Even though I shaved my beard, I look older.
Oh.
No, and Dr. Kovac actually was in the OR and he was saying, "So you turned 30, so, like, what are you looking forward to now as, like, as 30? Like, what are your goals and stuff?" And it really made me reflect on, how far I've come but also obviously how much further I have to go, so, yeah.
Yeah. I think one of my biggest things, I know that in 10 years, I'm going to regret not spending more time with my girls. I know that's
Yeah.
going to happen, even though I try my best. There's nothing else I can do. I literally any time outside of work. But I think one thing tangible about training is I wish I got into the OR more as in my junior years. And I tell all the residents this is that oftentimes I felt like I was almost like a little bit in my 1 and 2 years, I was a little bit afraid because I didn't know how to perform these surgeries and I was almost intimidated by it. It's almost like I had a professor in medical school that said the subjects that you're intimidated by, you study less, whereas the subjects that you like, you study more and you become passionate about. So I think in retrospect, I would have loved to get into the OR a little bit more in my first few years.
That's a great piece of advice. I think engaging joyfully in the educational process is always a good thing to tell yourself and to tell your trainees. It's like I can remember getting just hammered with ridiculous questions by people that I had trained with at earlier states of my life. And it terrified me until the point where I just started like engaging with it. And I was like, all right, I'm going to give them everything that I've learned and everything that I've known. And it was like, the more I put myself into that space, the more they were like, okay, great. This is what you don't know. Now I'll start teaching you. And it really taught me to engage in that type of Socratic method and be like, okay, just lean into that discomfort.
Yeah. Should I get to the last two fun questions?
Yeah.
Oh, we have fun questions.
These are, we ask these to everybody on the podcast. So the first one is, do you listen to music in the OR? And if you do, what do you listen to?
I love to listen to music in the OR. There's nothing that makes me crazy like the sound of like just beeping and silence. I will let people, whoever's putting the music on gets to pick, which is actually really fun because you get to expose yourself to all different types of musical genres. When the patient's awake, they get to choose the musical genre. And like last 2 weeks ago, I had a patient who asked for Jamaican dance party music.
Wow.
I was like, that is a genre I had never listened to before, but I tell
Was
you
it
what,
good?
it's really good OR music.
That's one.
But if I'm left
all
to
of
my
a sudden
own...
they see you like dancing.
Yeah. It's like I got dreadlocks going on now. And it was great. It was kind of like a Rastafarian. Like that's definitely who he was, and that was definitely his music. But it was really fun. It was good music. Left to my own devices, I would probably choose like Arcade Fire or Spoon these kind of like indie alternative from my older era.
That's awesome.
That would be the generators.
Yeah. And then the last question is, what's your favorite surgical instrument?
Oh my gosh, how do I pick just
That's
one?
hard. Yeah.
Gosh, I was like in my little, I could make like a 3-instrument set. That would just be my dream set. It is somewhere between a Smooth Gerald and a Webster needle driver. And those are probably the
Webster
two.
needle driver is
That's
a great
good.
one. I think is that a first, Hank?
I think that is a first. I think they're both firsts.
They're both firsts.
Yeah.
Okay. Yeah. Those are great instruments. You can do a lot of operations with those two instruments.
Yeah. Well, I'm bummed we didn't get to see your cat.
I know. She'll probably walk back in a minute we turn this off.
But thank you so much for joining us tonight. I think that, Hank and I talked a lot about this tonight and when we were going through the questions and you're just such the perfect person to talk about like not only like life lessons, but your journey across the country. Cause I know it's not easy. I lived it through you just looking at your pictures but we wish you the best of luck and WashU is so lucky to have you.
Thank you.
Yeah. So thanks so much for joining us.
Yep.
I really appreciate the honor. Truly, it does make me feel like I have made it in plastic surgery to be invited to.
Are you kidding me? Likewise, back at you.
And,
it feels like...
and also, Dr. Sachs was one of our earliest supporters, and he has an episode on here, so he's definitely going to love to listen to this episode.
I want to tell you one thing about the Dr. Sachs episode.
Oh, yeah.
Is Dr. Sachs episode, we're an hour and a half in, and it's still going. There's no there's no end in sight, to the point where Hank and I get off the episode and we get texts immediately is like round 2. When's round 2 happening?
Yeah. He's like, when are we doing round 2?
I'm telling you, he has so much energy. I've never met someone who has more energy than that man.
And talk about a good person for you to be with. Just quickly, Justin Sachs is one of the reasons why I did plastic surgery. He is such a great person. And talk about like energy, but also at the same time, somebody who has time for his family, time for the things that he loves. And I mean, you're in such a good place.
No, I feel it every day. I feel really grateful.
Thank you for listening to The Deep End. a plastic surgery podcast. If you've enjoyed today's conversation, please like, subscribe, and leave a rating on Apple Music or Spotify. Video from the podcast is available on Instagram and YouTube at The Deep End Podcast. Join us again soon for more conversations with luminaries and experts in the world of surgery.